Hey everybody, I'm Will Martin. In this video, we're going to talk about the electronic health record. And if you work in healthcare, you probably have very strong opinions about it, one way or the other. And if you're a patient, you probably appreciate it if you've been a patient recently because you can access your records, you can access your lab work, imaging studies, even your doctor's note now, which is, I don't know. There's pros and cons to that because you have to be able to interpret what you're reading. Oftentimes, it leads to misinterpretation. But in any case, we're going to talk about a study that was done recently, earlier this year, and it looked at the consequences of using this electronic health record on patient care. And particularly, they looked at nurses work in the emergency department. And I work in the emergency department. I've been an ER nurse practitioner for over 25 years. And so I started out with paper charts, and then I started out after paper charts. We went to this thing called a T-sheet, which was basically a checkbox sort of way of documenting that was faster, and you didn't have to write as much. But it was difficult to decipher. If you had to look back on it 2 or 3 years later to figure out what you did for a patient, it was difficult to figure out what's what. So then in 2014, everyone was mandated to have the electronic health record up and running in their hospitals and in their medical offices. In my hospital, we started, I think, in 2012 with a full EHR. So anyway, let's take a look at this study here. This was done in the Applied Nursing Research Journal earlier this year, 2023, and it's entitled Unintended Consequences of the Electronic Health Record and Cognitive Load in Emergency Department Nurses. So basically what they wanted to see was there a cognitive stress? I mean, was it taking away, brain power from the nurses at the bedside by having to interact with an electronic health record? So in general, that's what it's about. So we're going to take a look here. First of all, a couple of terms to kind of go over. So what is the electronic health record? And as I said, it was instituted in 2014, mandated in 2014 as part of the American Recovery and Reinvestment Act. All public and private healthcare providers and other eligible professionals were required to adopt and demonstrate the use of the electronic medical record. And not just the use of it, they had to demonstrate meaningful use. And again, anybody that's been involved in healthcare and used the EHR, you know what I'm talking about with this meaningful use. Because one of the things that was required of me was to make sure that I encouraged my patients to sign up for electronic access to their health records. By doing so, every time a patient would sign up to access their records, it would register on some database and we would be awarded for that. Or probably not awarded, but we wouldn't be penalized, put it that way, through Medicare and Medicaid for reimbursement. So just to kind of go over that in a little more detail, meaningful use of the electronic health records as defined by Health IT consists of using digital, medical, and health records to achieve the following: improve quality, safety, and efficiency, and reduce health disparities. And then also to engage patients, in other words, signing up for the EHR. Improving care coordination and population and public health. It definitely improves care coordination because now you have multiple agencies and providers that can take a look at the same health record, although not the case all the time, and I'll mention that a little bit later. And then finally, maintain privacy and security of patient health information. I just wonder when that's going to be a problem. I think it already has been a problem, right? I think, wasn't it in Ireland? I think last year, the country's EHR was hacked, and all the patient records were out there for everyone to see. So, there's a huge risk involved with this EHR. But the argument is that there's more pros than cons. So here we are. We're using the EHR. And let's take a look here, a couple more definitions here. The American Recovery and Reinvestment Act also included financial incentives for healthcare providers who prove meaningful use of the EHR. Like I said, penalties were issued. And back in 2015, it started with a 1% reduction in Medicare reimbursement. And I think that percentage rose as the years went on, too. So you had to really focus on getting that meaningful use going. So we talked about nurses using the EHR. And what exactly happens when they use the EHR? Is it taking away from other tasks? Is it tasking their brain power in order to sit there with a computer and log everything? So that is what cognitive load is. It's the amount of effort that's exerted or required while reasoning and thinking. Any mental process, from memory to perception to language, creates a cognitive load because it requires energy and effort. When cognitive load is high, thought processes are potentially interfered with, and you don't want to be interfered with when you're being taken care of as a patient, I would suspect. So what happens, like when you come into the emergency department, you come through our triage, and you see the triage nurse, the first thing the nurse is going to ask you is, why are you here? What's wrong? And you're going to describe the situation. And that's going to probably lead very quickly to a triage assessment of, do you need to be seen right now, or can you wait a little while? And this is essentially sick versus not sick. Not that you're not sick, but I think you can imagine that there are some people that are sick and require immediate resuscitation, and then there's others that probably can wait a little bit longer. So then the next step for the triage nurse is to ask a barrage of questions. And this is where you'll see them on the computer typing away as they're asking you questions. And some of these questions include things like, tobacco use, alcohol, other drug use, sexual activity. I mean, those things all make sense, right? But then there's also several other things here, too. They're going to ask you about your occupation, your marital status, your spouse's name, the number of children that you have, the years of education that you've acquired, what preferred language you like, what's the story as far as intimate partner violence? Do you feel safe at home? That sort of thing. Do you have strains on your financial resources? Is that causing stress? Do you have food insecurity at home? Is your housing situation stable? What are your social connections? Do you have family? Do you have other support mechanisms out there in the community? What type of physical activity do you take part in? Are you depressed? Are you suicidal? And then finally, what are your transportation needs? How do you get around? How do you get to the doctor's appointment? Do you need a cab? Do you need us to arrange for something? Do you have your own car? Whatever. And then finally, after we get to all of that, then we can get to the things that matter a little bit more, and that is the medical and surgical and family history that the nurse will take. They'll also ask you your medications and take a thorough medication history. So all of the questions that I've just mentioned, they all have a purpose, but they're adding to the time that the nurse takes away from either more fully evaluating you physically or keeping track of the waiting room, because they're managing not just you. Let's say we're talking about the triage nurse. The triage nurse is not just taking care of you. They're also trying to surveil and monitor everyone else that's in the waiting room. Because as you can imagine, people's conditions change while they're sitting in the emergency department, especially in the waiting room. You may come in with something that doesn't seem too serious, and then as time goes on, and we all know that you can sit and wait for a long time in the ER, all of a sudden your situation has changed. The triage nurse is the one that has to keep on track with that and keep tabs of the situation. So the questions, they all have purpose, but they do add to the cognitive load. So in this study, what they did was they purchased a database, I think from the Emergency Nurses Association, and the ENA spit out 1,000 random nurses that were members of that organization, and gave that to the study researchers. And these folks got 1,000 members to try to track down and send a survey to. Out of those 1,000, they were able to get 304 valid participants. and that's a response rate of 30.4%. They were actually shooting for a lot less than that, so I think they were pretty happy with what they got. Now, some of the questions that survey participants were asked were based upon validated research tools. And one of the research tools asked specific questions about how often certain issues occurred while they were at work. There were 36 questions total. But these are some examples. And these were examples where the nurses said, these things happen at least once a month and maybe more. And so these are fairly common issues that occur in the emergency department while using the EHR. And so the first one is, the question was, how often does using the EHR increase your workload? Most nurses said it increased it significantly. How often have you seen patient safety issues arise from using EHRs? Again, it was more likely to happen at least once a month, if not more. If one computer's not working, how often do you use different computer stations? I mean, these things happen all the time where you'll use a computer and then for whatever reason that computer just decides to freeze up and it's not working. And then you have to go search around for another available computer. And there's a limited number of computers in the emergency department when you consider all of the nurses and the physicians, the PAs, the residents, the medical students. Everyone is vying for a computer. There's not enough computers for every single person that needs one in the ED. And so if you are on one that all of a sudden freezes, you're done and you have to go search around for another computer. Instead of taking care of a patient, instead of spending some time at the bedside talking to people, you're searching around for a computer. Several of the other questions here, how often did the EHR issue create an unsafe patient care situation? For example, when you needed to administer a medication urgently. How often when entering data into the EHR do you have to leave your computer before finishing because you get interrupted? These are all things that happen day to day when you are using an EHR in conjunction with taking care of a patient. So a cognitive load, the cognitive load portion of this was measured using a NASA tool. And it quantified the degree of cognitive load based upon the amount of tasks that the nurse needed to perform. And to boil it down, this cognitive tool went from a scale of 0 to 20. 0 meaning no cognitive load whatsoever. 20 meaning completely unmanageable. You're overwhelmed. You can't think any further. And most questions that were asked measured a cognitive load between 10 and 12. So somewhere kind of in between. Not quite, I think, what the researchers had expected. I think they expected that with the use of the EHR, the cognitive load would also increase. And that wasn't really the case, interestingly. What they did find in the results was that nurses between the ages of 50 and 59 suffered the most cognitive load through the use of the EHR. And I guess that's not too surprising, right? Because most of the nurses in that age group or beyond probably started out like I did with paper charts. And I think a lot of the nurses that were polled in this may not have been full-time nurses. Some of them might have been part-time. So they may not have as much contact, as many hours using the EHR. So every time they come back to work, it's like starting all over again. But even so, I mean, it's just a fact that some folks just don't assimilate well to computers as compared to others. The other thing that really wasn't explained too well here, and I have no idea why this would be, but geographically, nurses working in the Northeast U.S. had the greatest positive correlation between cognitive load stress and the EHR. Now, maybe that's because in the Northeast, I mean, we have major cities and emergency departments are busier, and that's probably what it is, but we don't know for sure what the correlation really is there. So overall, though, cognitive load really wasn't a big problem according to the research findings. What the researchers did find was that there were a significant amount of reported unintended consequences related to the EHR. So, some examples of unintended consequences based upon those questions I just listed: documenting on the wrong patient, orders entered on the wrong patient, errors when nurses were emergently administering medications. You know, because this EHR has been around for, well, since 2014, you would think that by now most nurses would have really gotten a good grasp on the use of the EHR and that there wouldn't be unintended consequences through its use. But it looks like just the opposite, that maybe what's happening is, as time has gone, the EHR has evolved. It's become larger. It's more time consuming than it was. I mean, I can remember in 2014 when it started, it was relatively straightforward and simple. And now there are multiple pages to fill out. There's ways to work within that EHR that I don't even understand, and I use it every day. I have my own workflows, how to make things happen in this electronic health record. There's probably more efficient ways, but I'm kind of stuck in my ways. I know how to get from point A to point B, even if it might not be the most efficient. So this is the findings of this study, that cognitive load really wasn't the issue. The issue was that there were several unintended consequences related to EHR use. Obviously, what the authors are suggesting is that there should be some further research in it, and that also, as EHRs continue to evolve, that you should have nurses involved in the design and conceptualization of the EHR. And that goes without saying. You probably should have healthcare providers and nurses and everyone else involved in every aspect of designing the healthcare complex, whether it's the hospital or the clinic, the EHR, whatever it may be. The stakeholders should include nurses, right? I mean, that just makes sense. So if you've worked with EHRs and you have some specific comments or questions, please leave them in the comments below. I'd like to hear your opinion. I use the Epic system myself. I don't know how many of you are using Epic, but if you're using Epic, let me know, and let me know what you think of it. And I guess that's it for right now. We'll talk to you on the next video.